I'm going to talk about some of the work that we've done around patient safety collaboratives that some of you may be familiar with. I'm one of the head of programs at the Academic Health Science Network, so Neil, my colleague, is another one who specifically looks after digital. I'm looking after clinical trials, integrated care, long-term conditions, and I've recently got the patient safety brief, so it's quite a diverse role really. What I'm going to do is just give a bit of background on the collaboratives, talk about the questionnaire that we've undertaken just recently that I hope some of you have seen, talk about the way that we think we're going to take the Patient Safety Collaborative in the West Midlands, and then talk about some of the next steps and things that we need to think about. So in terms of where this come from, it's really as a result of the BOIC recommendations, Francis report. NHS England and NHS-IQ are directing the establishment of collaboratives, patient safety collaboratives, across the 15 AHSNs, and in the West Midlands, obviously that falls to us. So the collaboratives, shouldn't be seen as a healthcare regulator or a performance manager. What we really want to do is offer support to colleagues and organisations across the region to really achieve their goals. We want to build on best practice, we want to share experience and try to develop the safety culture. As you'll see on there, we are charged with developing this across the NHS and into non-NHS organisations as well, which brings a very interesting dynamic. It's called the NHS England, NHS-IQ wall of patient safety activities and areas. Basically, everyone has to, all of the patient safety collaboratives have to think about leadership and think about measurement. So I'm very interested on people's reflections really on, how the informatics community sort of helps shape this, and what does it look like? What does good measurement in this area sort of look like, and the informatics tools sort of behind that. We also have to sort of choose at least one of these areas to work on, and as I'll come on to describe, there's probably a number of areas that we in the West Midlands will work on, and a lot of this has come out of the questionnaire that we've undertaken. So apologies, I guess some of you at the back probably won't be able to see this, but we can make the slides available. So what we've done, we've conducted a questionnaire really to determine who is active across the region in patient safety, who wants to collaborate in this initiative, what kind of priorities are there across the region, and what evidence-based approaches are already being used that we can build on as we move forward. And also, what sort of training do colleagues want as well? So a wide range of questions that have been asked to individuals. So we've had really tight timelines to sort of bring this together, and we need to have a first go at the approach for the region on the 14th of October. So we've really had these 3 or 4 months over the summer to actually draw this together. But anyway, we've done the questionnaire, and we sent it out between the 28th of August and the 9th of September, and within that space of time we got 47 responses. Some of the responses were actually just people testing the system. They wanted to see what questions we were asking, but we managed to get 41 responses from people who made very, very constructive points about the way forward, which in the time frame, given it was the end of August, I think was incredible. We've also had a huge number of emails that have come in saying that people want to collaborate within the initiative. I've had so many emails, it's been hard to actually respond to all of them within the time frame. So if anyone's here that's actually emailed me and haven't responded, I do apologise, but I will get back to you. But the response has been fantastic. We've heard from primary care, secondary care, voluntary sector commissioners, really everyone from all parts of the West Midlands. And we've had 30 colleagues saying that they want to be involved in our steering groups. And there was 30 colleagues just who did the questionnaire, and you know, I've had all these emails as well. So a huge response. At a time of year when you'd expect people really wouldn't want to sort of respond to too many things, and I think it's probably just the tip of the iceberg, and I think it'd probably be a challenge actually engaging everyone as we go forward in this. But in terms of the feedback that we got from the questionnaire, when we started this, there was a lot of interest from colleagues around sort of pressure ulcers as well, and sort of some of the linked sort of work on nutrition and hydration, sort of moving into acute kidney injury. And other colleagues had mentioned falls when we had some preliminary discussions. So we asked colleagues about what they thought about this when we sent out the survey monkey. And we were talking, it was about, you know, over half of the people were in favour of the proposals, which was good and gives a lot of confidence. But we had a lot of other suggestions as well. Lots, as you might imagine, on the kind of human aspects of patient safety, getting the culture right, leadership and communication right. Quite a lot on deteriorating patients, medicines management, dementia and delirium and other mental health issues. Reporting systems, paediatrics was a very popular area, and support for falls. So a whole range of issues that were coming out of this questionnaire in terms of the safety topics to focus on. And we also heard a lot about evidence-based initiatives as well. I mean, this is just a snapshot. But to support, you know, a lot of the work, we obviously want to know what's out there to roll out in the future. So, you know, we've heard about, you know, malnutrition projects in the community that have the potential to be sort of spread more widely across the region. Programs to reduce falls in hospitals. Programs to also sort of improve those team working skills as well. So lots and lots of approaches really that can be taken. So it's been hugely valuable, the questionnaire. And in terms of training as well, human factors, we've noted, you know, people want more training made available on this. You know, there's a desire to sort of learn more about sort of learning from incidents and other risks, deteriorating patients and medicines management as well. And I should say that with the AHSN we have a drug safety programme and work stream, so that some of the feedback that you know, comes out of this will be fed sort of directly into them. But similarly, we want to make sure that the fantastic work that they're doing is also sort of made available through the sort of patient safety collaborative in general, as we, you know, report back nationally. We also got a lot of helpful feedback on the way that the collaborative should be run. The programs that we're working on should be developed through open consultation and agreement with stakeholders. This can't just be another initiative that, you know, the perception is it doesn't add any value. You know, we've got to add value. We don't want to, you know, sort of, you know, overburden colleagues as well, and innovation fatigue was really highlighted as a big issue. We need programs that are sustainable and will be spread across the region. Colleagues were talking about change at the front line. There was a lot on, you know, collaboration across the system as well. A lot of the initiatives seem to focus on one sector, and what we want to try to do is, where possible, work on programs that span the different sectors. Evidence-based and best practice approaches, clearly avoiding duplication, and we've talked about training support. So a huge amount of very valuable experience and knowledge has sort of come through the questionnaire. So just in terms of what we've done with this information and with other work, I've been working with a colleague, Jeannie Edwards, who's an external consultant, but she's worked on a lot of these collaboratives and bringing collaboratives together before. So working with her and looking at the feedback that we've had from the questionnaires and talking to people in a focused way around the region. We have really started to think about putting together collaborative networks of experts in these different areas. Clearly the networks have to be West Midlands wide and involve appropriate colleagues, including the patient voice as well as appropriate. Leadership and measurement is going to be absolutely key. We need to make sure that we, on the measurement side, that we are looking at the right data, we're looking at the right informatics tools to make sure it happens and make sure that the initiative is successful and we're looking at the right information. It's clearly a hugely complicated area to work in, and but we need to reach out to groups like this to make sure we get our approach right. We're looking now, I've mentioned sort of pressure ulcers and some of the associated things. We're looking at programs that as I said, sort of span the community and hospital settings. We want to do something around that. And some of the other issues that came out with really strong support as well. I mean, you looking at sort of children, mental health came through very strongly. Trying to do some work around simulation. And now it may be that something like simulation fits in as a sort of with different representatives in each of these sort of sub groups, or it may be that we have a group on its own. I'm not exactly sure, but we want to have an event. Well, we are going to hold an event in November. It's looking like the 5th of November now, where we bring everyone together who has an interest in patient safety and wants to be a part of the collaborative and collaborate in the collaborative. And we will look at the questionnaire results and collectively, as a region, as much as that's possible, try to prioritise some of these areas where we want to undertake focused programmes of work. And I think the approach that we'll take is sort of like, encourage. Well, we're asking those networks of individuals to actually determine and review the evidence that's out there, the approaches that are appropriate, the data that's available, and really develop those approaches, and we'll take them forward as appropriate. Of course, we don't have unlimited amounts of money, so we're going to have to sort of focus on maybe 3 or 4 programs of work that we can roll out across the region. So in terms of the next steps, there's a national launch of the Patient Safety Collaboratives on the 14th of October down in London. As I said, on the 5th of November, we're planning around there for the West Midlands launch, where we will ensure that we get engagement and agreement on plans and the priority areas that we're looking at. And it would really be fantastic if people here that were interested, could attend that event. We've had such sort of a sort of strong response to the questionnaire, and with people sort of emailing me separately, that if you want to attend, you probably better get in quickly. But I'll put my email address up, and if you're interested, please sort of drop me a line, and we can put you on the list. We have to now start thinking about the sort of key appointments as well to the collaborative, and there are areas that we really need to think about. Clearly, informatics is a sort of a massive area that we need to get right. But there's other things as well. Patient-public involvement as well. What should we do around that? There are other programs of work within the AHSN around drug safety that I've mentioned, and some other work around the innovation and adoption that deal with patient safety. So we need to think about how that's sort of integrated in as well. So, and there's a variety of other governance arrangements that we need to put in place. But we've pulled this together really quickly. We've got a tight timeline on it, but now we need to start thinking about the next stages. And so, I would really appreciate sort of any reflections on how we get the sort of the informatics side of things right.